everyone, and thanks for tuning in to this snippet edition focused on remediation. I don't think resident remediation is anyone's favorite thing, but it's certainly necessary for those of us in the GME world. And what I found is that us working in GME who deal with resident remediation issues, we're always seeking ways to improve the remediation process. Every situation that requires remediation is somewhat unique, and so unfortunately we're not really able to apply a one-size-fits-all concept. And that's why you see the puzzle pieces here at the top of this infographic, and I'll zoom in a bit there. You can really compare remediation to a puzzle. You're not really sure where the pieces fit together, and it may take you a few tries to really get it right. In my experience, I've learned something new with each remediation encounter that I've been a part of, and many times I've been left feeling like something could have been improved, maybe in the process, or in the communication, the delivery, and many times even in the documentation. I don't think any of us want to feel this way when all is said and done at the conclusion of the remediation encounter, whatever it may have been. So we want to be able to put the pieces of the puzzle together more easily. There's always going to be differences with each remediation encounter we face because the residents are different, they learn differently, they have different personalities, and certainly different deficiencies. So just for the heck of it, I looked up remediation in the dictionary, and the first definition that came up was the act or process of remedying. Clearly, this definition does little to help explain what exactly remediation is. It's vague, it leaves us wanting more of an explanation. So I think this is exactly how many of us feel when we discuss resident remediation, and it's that puzzle again. What you probably want to see when you look up remediation, and I actually did after looking on a couple of different pages, and of course this is the online dictionary, is you probably want to see something that says the act of correcting or to put right or reform. This gives us a much clearer picture. As GME leaders and educators, it's important to remember that our goal is to provide an educational program that leads to residents being able to competently practice medicine independently. And sometimes remediation is necessary in order for residents to reach that end goal. We have to remember that residents are still learners, and we have an obligation to provide the necessary tools and resources to the best of our ability in order for the residents to achieve that goal. So there's been entire books written on resident remediation, hour-plus-long presentations on the topic as well. So the goal for this short snippet on remediation is to provide you with the basic tool to assist in the different stages of the remediation process. So think of the remediation process in terms of a performance improvement process, and that's really what it is anyways. It's improving some aspect of a resident's performance. So I've applied the Performance Improvement Methodology, PDCA, or Plan, Do, Check, Act, to our remediation process here. And since this methodology starts with the plan in which a deficiency has already been identified, I think it's important to actually take a step back and address what comes before this stage. How do we actually identify deficiencies and residents that are in need of some kind of remediation? This is really the key, the early identification, and it's key for better chances of success as well. So misconduct and professionalism issues are usually pretty easy to identify. It's the academic deficiencies that can be a bit more tricky to diagnose, especially because you have multiple evaluators across several different settings. A resident may function very differently in an outpatient setting versus an inpatient setting, for example. The most important thing is to recognize the need for remediation and to intervene early. So how do programs do that? So some of the puzzle pieces that you see here on the screen will provide you with the tools that you should be utilizing to identify deficiencies. And I'm just going to highlight a few of them. So first and foremost, I think you have to set expectations and communicate those expectations to residents. So in a residency program, the expectations are mainly going to be in the form of competency-based goals and objectives. This is going to include your overall program objectives as well as your rotational objectives. Well-written goals and objectives are going to clearly outline the expectations, not just for the resident, but also for the evaluator. Setting these expectations can really be helpful to diagnose lower performing learners. So just as important as having well-written goals and objectives is having an evaluation tool or multiple tools in our case in medical education that really measure how well residents are actually meeting the expectations that you've set. So your evaluation tool must align with your goals and objectives. And with multiple evaluators in a residency program, the program directors really rely on the evaluation tool to tell them how well a resident is meeting the goals and objectives of the program in general or of that specific rotation. Clinical competence committees are certainly another way of recognizing the need for resident remediation, and this is the forum to discuss and evaluate residents as a whole and really review their progress throughout the course of their training. The committee members collectively should be able to pinpoint where deficiencies may be occurring based on multiple forms of evaluation and feedback, all of which are typically reviewed at clinical competence committee meetings. And then finally, the milestones. We know that the milestones are competency-based developmental outcomes that are demonstrated progressively by residents throughout their training. They provide descriptive behaviors of skills, performance, attitude, and knowledge. So the milestones allow clinical competence committees to easily fit residents along a continuum based on demonstrated behaviors. So they really aid in identifying struggling residents earlier, which is a great thing. They provide more explicit expectations of residents. So the residents can actually see what behaviors they should be displaying in order to move to the next developmental point along the continuum. The milestones really paint this picture, and it certainly helps in remediation situations. So you want to go back and take a look at your program goals and objectives, what evaluation tools that you're using, and your clinical competence committee proceedings. And make sure that those things are designed to help in your assessment of resident performance. You don't just want to have them because they're required by the ACGME, but you want to get the most out of them. Make sure your residents have an understanding of what each of these things are as well. So now we can go back and look at our actual remediation process, again, which is going to be our PDCA process. We've identified a resident with a deficiency, and our first step is to develop a remediation plan. So some key components of a remediation plan will be a timeline, goals that are specific and measurable, and follow-up plans. And the follow-up plans are going to include next actions if there's little to no improvement. So the timeline, starting with the timeline, that's very important, especially in residency training, where residents are essentially given 12 months at each level before moving up to the next. So you want to be sure to give residents enough time to develop and make improvements if a particular deficiency has been identified, but you also don't want to give too much time, which may leave you with fewer options if the resident has made little progress. It's also important for residents to receive feedback and get evaluated frequently when they're on a remediation plan. You can even formalize this a bit more and set up checkpoints throughout the timeline that you establish. Certainly consider the goals of the remediation plan when you're determining an appropriate timeline. And the goals should be specific and measurable, like I said before. And so let me give you an example. Let's say that a resident is having issues translating medical knowledge into patient care. So you may have a goal that actually states, resident will create differential diagnoses based on patient age, gender, and chief complaint to include most likely diagnosis and what you don't want to miss. Resident will analyze each diagnosis with faculty and/or senior resident. So this goal is certainly specific and it is measurable. It allows for immediate and direct feedback from faculty or a senior resident on whether the differentials that the resident presents are appropriate. And then you're also able to measure the frequency with which the resident comes up with appropriate differentials and determine whether there's a lack of medical knowledge in certain areas. As part of the remediation plan, I would also suggest incorporating specific action plans. So instead of just coming up with goals for the resident, provide them ways and examples of how they can achieve those goals. This just adds another layer to your plan, which is going to help guide the resident towards success. And then lastly, as part of our remediation plan, we want to include follow-up plans. So outline how the resident will be reassessed and then what will happen at the end of the timeline that you've set. I think it's important to let residents know exactly where they stand in terms of progressing to the next level, whether it's having something to do with contract renewal, extension of training, or whatever it may be. At the follow-up meeting, I think you should be prepared to kind of paint this picture for the resident. So, for example, you may see that there's been little improvement and you want the resident to remain on a remediation plan, and then you're going to reassess again, say in 2 months. At the end of the 2 months, you'll make the decision on whether the resident will be promoted to the next PGY or you're going to extend the training in the current PGY, and this is just an example. So I would be completely honest and explicit. Tell the resident this. The resident should really know what the possible outcomes are. And there's not going to be any right or wrong answer. It's more what's right for the resident and for your program based on the type of deficiency and the type of remediation that is happening. What outcomes are appropriate given the type of remediation needed, and that's something that you really should be thinking about early on, and you want to communicate that to the resident. So the next step in our remediation process is the do, actually carrying out the remediation plan. Well, this step I think seems really simple. It's actually what happens here that determines the success of the remediation plan. It can also be resource intensive, so it may include the use of a resident mentor, and in some cases, I think specifically with academic deficiencies, it's really beneficial to have faculty who are going to be working with the resident throughout the remediation period, that timeline you've set. Those faculty should really be aware of the plan. I think their awareness and involvement are needed in various strategies to help address the deficiencies and so that the resident can improve. It's important to remember that carrying out the remediation plan is a two-way street. So residents must apply self-directed learning techniques to help improve, and then as programs, we have to help the resident develop learning strategies based on their learning style. The success of the remediation plan is certainly dependent upon these two things, and you should reiterate that to the resident as well. The next step is the check, checking whether the resident has met the goals of the remediation plan and are they functioning at an acceptable level of performance. So remember that the goals developed in the plan stage should be specific and measurable, so this is going to make it very easy to assess whether or not the resident has met them. Feedback from faculty and other residents should be considered. The program director can't possibly provide direct supervision for every encounter that a resident that's on remediation has, and so they have to rely on others in the assessment of the resident. And the milestones are a good tool to use in this step of the process as well. While they aid in early identification, like I mentioned earlier, I think this still reigns true even in the check stage. Are the original deficiencies present, and maybe are there new deficiencies that have developed? Lastly, what you find in the check stage, which the outcomes are going to have an effect on the act, the final stage. If the goals of the remediation plan were met, then there may be no further action to take. As with all residents who are performing at an acceptable level, though, I think it's important to look at and discuss how the resident may further improve to reach an even higher level of performance. You don't want residents to become complacent. If the goals of the remediation plan are not met, then I think you have to have several discussions, and then decisions need to be made based on the deficiency, the timing, and your program structure. So it may be that the resident remains on remediation, in which case you would actually start this PDCA process all over again, and you would have a revised remediation plan. So some key takeaways and things to remember. Early identification of deficiencies is certainly important, and I've included some tools and some different things that you're likely already doing that can help you in the early identification process. Having a defined process. So using a performance improvement methodology can really help to provide you a more organized approach to resident remediation. And you can't do this alone. So it's important to tap into all of the resources around you. There's faculty, you have other more senior residents, chief residents that can help. Your clinical competence committee milestones are all good tools to help you really along the way in the remediation process. And that will get you to your end goal. So that's it for this snippet. I hope you found it useful, and I hope that it can aid in your future need for resident remediation. Thanks.